Okay, so I want to give you some insight on how to determine which type of back pain you have. There's three really common types, which are about 80% of people that are struggling with back pain fall into one of the three categories. But I think the conclusion that I want to help you come to here, and I want to help you understand, is that the type of back pain, you could call it the diagnosis as well, is not the cause of your back pain. I'll let that sink in for a second. So the type of back pain is not the cause of back pain. And so why do we name things? Why do we have to come up with a type? Well, the type does help us come up with a solution because certain types require certain things as far as treatments to relieve it. But more importantly, I think that the names are there so that health providers can communicate and we can name something that we see, but usually, and it also makes you feel warm and fuzzy inside to have a name for something. But I can tell you that the name most of the time isn't even accurate to what's actually causing it. So, earlier we talked about, should I get an X-ray or an MRI? Well, the X-ray and the MRI is what actually gives you the name most of the time. And yet we already talked about how most of the time when we get you can image the majority of people walking around on Earth, and with no pain, and you're going to find something in their spine that's abnormal because it's normal for our spine to age over time, just like our skin. And so, that name that we get because of the image does not give us the true cause. And so, but I do want to cover how to help you understand the type or the diagnosis. And it's not a true diagnosis for you as an individual because I'm not with you individually. And this is not what this course is about. It's not about individually diagnosing and treating people. It's about giving information and confidence and direction and strategies and techniques that you can try. But again, none of the results here are guaranteed. I don't know what you're going to do with this information, but I can tell you that this is not a diagnostic test. But I'm going to give you information on how to understand the different types. So the first type, most common by far, is stenosis. Stenosis is the Latin word for narrowing. It also has other names, right? Its other names are degenerative disc disease. Remember we talked about how like 37% of 20-year-olds without pain have it on an MRI, and 90% of 80-year-olds have it on an MRI. It's also called disc degeneration, black discs, narrowing, or arthritis. All those mean stenosis, which essentially means narrowing. So we've got 4 questions that help us. You can get an image, which will also help you be told that you have that. But again, the image is going to show you that you have stenosis, whether or not you have pain or you do have pain. It doesn't really matter. So again, I would highly recommend not getting an MRI or an X-ray unless you have those 4 red flag symptoms we mentioned earlier. But these 4 questions actually are more accurate than an MRI. So they're 97%. It's called the clinical predictor rule. 97% accuracy if you answer yes to these 4 questions. So here's a test. This is for stenosis. Number 1, do you have pain in your back with walking? Number 2, do you have pain in your back with standing? Number 3, are you over the age of 55? And number 4, does the pain go away when you sit down? If you answered yes to all 4 of these questions, there's a 97% chance that you would have stenosis if given an MRI or an X-ray. Again, that's a type of back pain, but not a cause. I can't stress that enough. There is a movement assessment to give somebody that name, that diagnosis, or that type. 3 things. And the movement assessment is based on, we know that in stenosis, the hole in the spine, actually we know that the disc space narrows naturally as we age. We also know that as the disc space narrows, that causes the hole where the nerve comes out to also narrow. So if I can take somebody through a movement assessment that makes that hole close down even more, then I have more evidence that we have a type of back pain, which is stenosis, not the cause, but the type. So we know that the hole closes down when you bend backwards. So if you bend backwards and there's more pain, it's a positive, 1/3 of the test. If your right side is the side that you suspect to be painful, if you lean to the right and it hurts, that is a positive number 2 assessment. And then number 3, again, what did I write down here? Pain production is positive. So if both of those were painful at the same time, so I extend back and lean to the right, for example, and that causes more pain, that's a positive test, and that would be an indicator for the type of back pain. Again, not the cause, but the type. It's important to recognize that. The type really helps you none. It doesn't help me. It doesn't help you, really. It just helps you feel warm and fuzzy that you have a name for it, but it does not help you come up with a solution. By far, though, the most common name is stenosis, arthritis, degenerative disc disease. Okay, number 2 is called the sacroiliac back pain. And here's how we find out if somebody has that type. So this is interesting because this one's kind of sneaky. It doesn't show up on an MRI or an X-ray, so it's undetectable on an image. Right? So if you're out there and you've got back pain and you know the images come back negative and nobody has an answer for you, there's a really good chance it's this one, right? So there's no specific test for it, really. There are some assessments that are there, which we'll talk about. So it doesn't show up in MRI. It's usually localized to one side of your back in one spot that you can actually point to, like with your finger. And the symptoms commonly are with sitting or laying down. It affects people of all ages. Very common for women before and after pregnancy, because of those ligaments around that joint get very loose due to the birthing process and the hormones released. But it doesn't discriminate. So and again, you can have all 3 of these types of back pain at the same time. But this one is very localized, typically doesn't have pain traveling down the leg. If it does go down the leg, it's usually in the groin area, the testicle region, the groin, and it can cause numbness, tingling, and pain in that region. And then the third most common is a disc bulge or herniation. And so again, how do we label that type? Well, the first thing we would do to label that as the type is the MRI or the X-ray. But remember, we talked earlier about how a significant population who has no pain will show a disc bulge or disc herniation on an MRI without pain. So again, that's why I'm saying repeatedly, the type of your back pain, the name of it is not the cause of it. We're going to get to the causes and what to do about it in a little bit. So with the disc bulge or herniation, there's something called a nerve tension test. And we're going to get to that. I'll show you that, but it's basically getting the sciatic nerve to move and glide along the disc. And if it is bulging or herniating, it will cause more pain during the test. I'll show you that later on in one of the modules. Number 2 is typically pain increases in the morning because the disc pressure is the highest in the morning. And it gets better as the day goes on. Versus arthritis or stenosis, it typically gets worse as the day goes on. And then number 3, pain increases with coughing, laughing, or sneezing. That's an indicator because we know that also increases the disc pressure and it pushes on the nerve more. And then typically pain with bending forward. That's an indicator as well. And then the 4th type is what's just considered mechanical back pain, meaning the way that your body, I would argue that all back pain is mechanical, but let's say if you had nothing that showed up on an MRI, but you still had back pain, so you're that like undiagnosed name. Well, all back pain is mechanical, but it means basically that the soft tissues and the joints and the discs are getting stressed out because there's too much movement occurring there. And it's because the areas above and below are not moving properly. And so they diagnose it as like idiopathic or mechanical back pain. Typically, it's pain with bending backwards, pain with bending to the same side, or pain with rotating away from the side that you're worried about or that's hurting. The type is not the cause, though. I can't stress that enough. The type is not the cause. You might have another name for your back pain that you got diagnosed, but I can tell you that it's not the cause. The name only is essentially looking at the imaging or the structures. It's not identifying the true cause, and so we will get to that in a bit.